Yes, we have been discussing about the statin. The statin, these drugs, they block the internal production of cholesterol. And cholesterol we need to use bile salt production. Yeah. So now the liver, you can see this pathway directly, very easy now. So what happened with the blood LDL? Going down. This thing we need. Yeah. If any person having hypercholesterolemia, if any person having hypercholesterolemia, so statin is a very good drug to decrease the cholesterol level. Understand? The statin is very good drug to decrease the cholesterol level. The statin, they're doing what? The statin, they block the internal production of cholesterol from the liver. Statin block the internal production of cholesterol from the liver. Now the statin only using LDL to produce the bile. So what happened inside the blood circulation? Inside blood circulation, LDL level decrease. Understand or not this idea? This concept clear about the statin? What is the site of action of statin? Site of action of statin is liver. Of course, you can see the enzyme present in liver, so this drug must go inside the liver. So what is the side effect of statin? Hepatotoxicity, because this drug act in liver can cause hepatotoxic, hepatitis. It's a hepatotoxic drug. Understand? It's a hepatotoxic. Site of action of statin in liver. So in liver they can damage. They can damage liver itself. So if you're using statin, this person must have a healthy liver. You can check the profile here, the liver profile, LFT. You perform liver function test. Oh, liver is okay. You still can use statin. If liver function deranged, then you need to stop statin. Understand? So these are statin, the statin family. In the statin common names there, the statin. Atorvastatin, atorvastatin, simvastatin, fluvastatin. Okay, they just at last you add here statin. Atorvastatin, simvastatin, fluvastatin, mevastatin. Okay, so just add statin at last. Statin. These are the statin. They make static cholesterol production. These are the statin. Understand? So these statin they reduce fat. So for if your body have very high level of LDL, you can use statin to decrease LDL. Understand? These are the statin. So statin, one side effect, they are hepatotoxic, right? Another side effect, they can cause myopathy. Second side effect, statin are hepatotoxic and also damage muscle. And also damage muscle. Okay, clear? Okay, now move on another group. Statin done. Statin done. Now another group, number two, bile resin. Bile resin. In this, we have the important drug here. I just write one name here: cholestyramine. Cholestyramine, the important drug here. Bile acid resin. Cholestyramine, another polysivalam, polystyramine, polysivalam, and last one, polystyrol. These are bile acid resin. What mean resins? Bile acid resin. Okay, this bile enter where? Enter to GIT, yeah? After fat absorption, this bile going back. How much percentage? 5%, yeah? 95% back. How much percentage going in feces? Just 5%. Understand? Just 5%. So when you eat the drug, you eating what? Bile acid resin. So bile, I just write a short form here. Bile acid resin, polystyrene, for example. So these resin, they're doing what? This is a bile come in your intestine. Okay. The bile acid resin, they're doing what? They bind the bile acid. Bind the bile acid. Understand? They bind the bile acid, not allow, not allow reabsorption. So they bind, this bile is come into the intestine, yeah, and 95% go back. If you use this drug, bile acid resin, the bile acid resin, now they eliminate the bile acid in the feces, or not 20% in feces. Before just 5%. Now tell me how much percentage going back. If 20% loss, it means 80% going back. Yeah, understand? If 20% loss, you use bile acid resin. So bile acid resin, they're doing what? You know the one term in chemistry we use chelation to combine something to make a complex. Bile acid resin, they're doing chelation. They combine, they make it insoluble. Okay, they make the bile acid insoluble, then this bile not is not reabsorbed and go back to liver, not go back, going little now, more loss in feces. Understand? If you're using this drug bile acid resin, so what happened with bile acids? Bile acid loss in feces, more loss. Yeah, now the bile acid, the feces in feces now 20%. How much going back? 80%. Now let me know here. If second time, you how much you give, you must produce 100%. If 90% come back, how much you produce new? Just 5%. Yeah. If 80% come back, you want 100%, how much you produce new? 20%. If 40% going in feces, how much you produce new? 60%. If 50% going in feces, how much you produce new? 50%. Understand or not? Clear? So it depends upon the drug how much the bile acid are lost. Before normal physiology, what normal physiology is saying? Only 5% of bile acid and bile salt they lost in feces. Yeah, almost 95% they go bad, and liver next time again produce new 5% and make it 100 and again give 100% to intestine for proper digestion. Understand? So bile acid resin, they're doing what? They're doing what? They increase the loss of bile salt from feces. They increase the loss of bile salt from feces. Clear? So what happened? Liver now must produce extra bile salt. To produce extra bile salt, liver now must use some extra cholesterol. Understand or not? How you produce bile salt? You produce bile salt by using cholesterol. Yeah, you produce bile salt using cholesterol. Understand? So if you use extra if you want to produce extra bile salt, because the bile salt is losing in feces more. Yeah, so you must use more cholesterol. To use more cholesterol, you must use more LDL. Which way is more easy for you? Already preformed cholesterol to get from LDL are produced from de novo pathway. De novo pathway, 10 step of metabolism, lot of enzyme working there, coenzyme, vitamins you need to produce cholesterol. Yeah, oh, it's a very hard way. Just now metabolism start after 2-3 hours, then cholesterol you can get. If already cholesterol, preformed cholesterol packed in vesicle in the form of LDL, you can take out, liver can take out. You eat like you have to have your meal after 4 hour lunch, dinner, breakfast, like this. You have a meal. You have a meal, you need a bile. Clear? If you using bile acid resin, you must produce your fresh bile. You need fresh bile again for next meal for proper digestion. Understand or not? Then liver doing what? Liver consume lot of LDL to take out cholesterol to produce bile. Why liver now using more LDL? Because liver have no much extra time to produce a lot of bile salt. Understand? Lot of bile salt is losing in intestine. So you can see this drug is very interesting drug. This drug not enter to blood and help to reduce my cholesterol. This drug entered to your blood? No, cholestyramine not going to your blood. Cholestyramine, just you eat the cholestyramine and you eliminate the cholestyramine. Just ingest and going in feces. Doing what? Nothing. Just take out bile salt along with. Understand? So this anti hyperlipidemic drug is interesting, has some interesting action. Just go inside the GIT and take out all bile salt out. So this drug without entry to blood reduce my lipid. Understand or not? Without entry to blood, it's reduce my lipid. Yeah. So bile salt LDL now LDL going down. So reason also reduce my LDL. But the problem, the problem. Diarrhea is the main problem. Yeah. GAT upset because disturb the bile. Yeah. GAT upset. If you combine statin, very interesting here now, you can see. If you block this pathway by using statin and also take out the bile out, oh, it's very effective. It's very effective combination. Very effective combination. Clear or not? Cholesterol to reduce LDL, statin combined with resin. Statin combined with resin, very good combination. No other combination is better. Okay, if you want to reduce your cholesterol in days, in few weeks, use statin along with resin. Understand? Use statin along with resin. Along with resin. Statin family combined with resin family. Cholestyramine. So these two drugs reduce your LDL. Done. These two drugs they reduce your LDL. About LDL, clear or not? These two drugs done. How they working? Statin and bile acid resin. If we combine, then very rapidly your LDL going down. Very rapidly your LDL going down. These two drugs done. Okay, next drug. Next drug. Fibrates. Next drug. Niacin. In five. What is niacin? It's a vitamin B3. Fibrate, in the fibrate we having phenofibrate, and gamma fibro of fibrates. These two drugs, niacin. Niacin doing what? Niacin act on, if you remember the first picture here, how we refill the remnant chylomicron, come here. Liver have ability to produce triacylglycerol. Okay. If you block this, then triacylglycerol will become low. So if any person suffer from hypertriacylglyceremia, the niacin not act on cholesterol better, but is act on triacylglycerol more better. The triacylglycerol synthesis block, okay, by niacin. So this drug niacin you can use for hypertriacylglyceremia. Hypertriacylglyceremia. What's your fibrate? The fibrate, how the fibrate are working? The fibrate working on one receptor, PPAR, peroxisome proliferative activator, PPAR receptor. P for peroxisome, P for proliferative, A for activated, R for receptor. Peroxisome proliferative activated receptor. So this receptor actually change the genetic machinery. Percongenes genetic machinery. So hepatocytes metabolism totally changed. Hepatocyte metabolism totally changed. Now liver doing what? Liver produce triacylglycerol very low. Liver doing what? Liver produce cholesterol very low. And now liver doing what? Liver cholesterol. It's very important action of this drug. Cholesterol elimination by the liver is increased. Cholesterol elimination increase where? In bile. This drug doing three things. Number one, production of TAG decrease, production of cholesterol decrease, production of now elimination of cholesterol in bile increase. So cholesterol production decrease, de novo pathway stop, yeah, not working well. And cholesterol in LDL is also eliminated in bile, extra elimination, yeah. So fibrate can work for LDL also. If your LDL is very high, fibrate also can work for TAG also, yeah. So this drug you can use for both. Understand or not? This drug fibrate you can use for also for obesity purpose. You also use for cholesterol decreasing, yeah. So this fibrate have action on the liver here, as also working inside the liver. LDL increase and TAG decrease. In that case you can use fibrate, because this fibrates doing what? They decrease production of TAG, decrease production of cholesterol, and increase the elimination of cholesterol. This pathway, we come here, this pathway, this elimination of cholesterol in the bile, the fibrates working here. Fibrates stimulate this step, okay, and fibrate decrease this step, cholesterol production, and fibrate also decrease TAG production, also decrease. TAG production also decrease. Understand? So this fibrate, they doing this, they take this LDL and change the cholesterol. They take out the cholesterol and stimulate this cholesterol elimination in bile. What is the side effect you must remember about the fibrate? You can forget every side effect. Not forget this gallstone. If you eliminate extra cholesterol very rapid rate, what happen? Gallstone. You remember gallstone, two type: cholesterol stone and pigment stone. It's a cholesterol stone, okay. The cholesterol, elimination of extra cholesterol in the bile. If more elimination of bile, just bile, just bile salt there, more bile salt in gallbladder precipitate to form the stone, okay. So the fibrate side effect, gallstone. Another side effect, same like statin, myopathy side effect. Myopathy, okay, understand? Myopathy. Myopathy and gallstone. Myopathy and gallstone. If you combine statin and fibrate, what happens with your muscle? Double myopathy. Oh, this combination not good. This combination not good, yeah. Fibrate not combined with statin because they can damage my muscle too much. Muscle damage, okay. Myopathy also side effect of statin. Myopathy also side effect of fibrates. Understand? So fibrates, they are having side effect gallstone and myopathy. We can use to reduce triacylglycerol. We can reduce to use this thing. We can use triacylglycerol. Understand? Okay, now come here. This niacin. What is side effect of niacin? Niacin inside the skin. They produce prostaglandin. Okay, niacin produce prostaglandin. If you remember, prostaglandin cause vasodilation, or prostaglandin cause vasodilation. If vasodilation, what happens with skin color, skin flushing, skin red, flushing, especially on face. Facial flushing is the side effect of niacin. Then you can use, if you want to block this side effect, you can apply NSAID. If you remember NSAID doing what? NSAID block the COX enzyme, yeah. If you block COX enzyme, then no more flushing. If you're using niacin in patient for TAG, to decrease the TAG, the side effect of niacin, flushing, facial flushing, important side effect of niacin. How you can avoid this? Give NSAID, okay. You can use aspirin. You can use like acetaminophen, any painkiller. That painkiller also block prostaglandin production. Niacin increase prostaglandin under the skin and causing flushing. Flushing is the important side effect of niacin. How you can avoid using NSAID? Using NSAID. These NSAID, they block the COX enzyme, no more production of prostaglandin, no more vasodilation, no more flushing. So you can combine niacin with NSAID, okay? Niacin with NSAID, then no more flushing. Not give listen here. Red man syndrome is a side effect of vancomycin. I will teach in antibiotic section. Red man syndrome is a side effect of vancomycin. That side effect is due to histamine release. Okay, for example, morphine also release histamine. It also can cause vasodilation, can be redness there, but that thing due to histamine. For that purpose, we can use antihistamine, not NSAID. Okay, the flushing here, the two different phenomena. The things are common here. For example, vasodilation caused by prostaglandin, also flushing. Vasodilation caused by histamine, also flushing, also skin red. Yeah. So can you use here NSAID if caused by histamine? No. Understand? Totally different thing. Okay. If vancomycin causing red skin, red man syndrome, that due to anti, that's we can block this by using antihistamine because of histamine. That flushing due to histamine, that redness due to histamine. Here the niacin causing redness of skin by producing prostaglandin. Niacin causing redness of skin, flushing of skin, especially face, by producing prostaglandin. Okay, so prostaglandin you can block by using NSAID. Understand the two different things. Later this we will discuss in vancomycin section in antibiotic part. Okay. This is all about anti-hyperlipidemic drugs. Anti-hyperlipidemic drugs. To reduce the cholesterol, we can use statin. To reduce the cholesterol, we can use resin. To reduce the TAG, we can use niacin. To reduce the TAG, we can use fibrates. Understand? And last one is very easy. How the fat digestion? Come here. The first step here. Fat digestion. If you block, yeah. So this drug also work in intestine and block no more absorption. Okay, so this drug the person sometimes they use to reduce the weight. The person for obesity, the person with obesity they use this drug as ezetimibe. But the problem with this drug, what the side effect? Diarrhea. Which diarrhea? Fatty diarrhea. Okay, steatorrhea. Steatorrhea. Fatty stool, because fat not absorbed, not digest. So ezetimibe, so the cholesterol and lipid coming from outside, you can block digestion in the intestine. Okay, ezetimibe not mixed with resin different action. They just act on bile salt, they take out bile salt. Okay, they for cholesterol. Ezetimibe directly act on for this for digestion process to block the this one fifth one. Ezetimibe. It's all about anti-hyperlipidemics. Okay, tomorrow we will inshallah start another topic. Have any question you guys can ask. See you tomorrow inshallah. Assalamu alaikum.
Waalaikumsalam, sir.
Allah Hafiz.
Peace.